We're here today with Sharron Murray, a nurse who also suffers from migraines herself. Sharron recently wrote a book titled Migraine: Identify Your Triggers, Break Your Dependence on Medication, and Take Back Your Life. Sharron, welcome. Can you tell us a little bit about migraines?
I'd love to. Migraine is a genetic neurological disease that affects over 30 million people in the United States. According to the World Health Organization, next to dental cavities and tension headaches, migraine is the third most common health problem in the world.
I didn't know that. What causes a migraine?
That's a good question. It's believed to be related to a combination of complex events that involve oversensitive neurons, the release of inflammatory mediators, inflammation of our nerves, alterations in the neurotransmitters, which are chemical messengers in the brain, and vascular changes. It's thought that in the presence of an appropriate trigger, a combination of these events leads to what we know as a migraine attack. During the attack, we may have warning symptoms, which include food cravings and mood swings. Then we may get an aura, and that in the aura we may see zigzag or flashing lights. We may smell strange smells. We may have odd tastes in our mouth or hear odd noises. We may talk too fast or forget what we're going to say. And we also may get prickling or pins and needles and numbness on one side of our body. Then we get the headache. And with the headache, we can get nausea and vomiting, sensitivity to light and sound, and it's still not over. We may be left with a sore head and neck, which tender to touch, and lingering nausea.
You mentioned triggers. Give us a few examples of triggers.
I can, but first I'd like to say they're numerous and they're unique to the individual. And we have what is called a trigger threshold. So it may take one or two triggers for you and you'll get an attack, and I may be more fortunate and I may get 5 or 6 triggers before I get an attack. The common ones include caffeine, chocolate, alcohol, red wine, sounds like all the good things, doesn't it? Aged foods and beverages, foods with chemicals, additives, preservatives, MSG, hormonal fluctuations, magnesium deficiency, loud noises, bright lights, in particular fluorescent lights. Then we can have fatigue, hypoglycemia, dehydration, and a big one, changes in weather and altitude. And I just want to say a word about stress here. Although stress isn't recognized by the International Headache Society as a trigger, it can make us more susceptible to all of the triggers that we have, and if it's chronic, can lead to chronic migraine.
What's the worst thing about having a migraine?
It robs us of our lives. Many of us have to give up our careers and our dreams. For me, I had to give up a dream of a doctoral degree and a career as a tenured faculty professor in my nursing school. It also steals moments and events we cannot recreate. For example, weddings, funerals, graduations. It limits our restaurant choices, our movies, concerts, even the music we listen to. And it also can limit our travel.
How are migraines typically treated today?
In Western medicine, the conventional treatment is medication. It usually consists of a regimen of pain relievers, abortive drugs, and preventive drugs.
So why did you try acupuncture?
Many of the pain reliever and abortive drugs, if they're taken more than 2 to 3 times a week, can lead to rebound headaches and chronic migraine. I took too much of the abortive medication Imitrex to maintain my hectic lifestyle, and I crashed. My doctor told me I had to reduce my dependence on medication. A friend told me about Dr. Mao, and so I tried acupuncture.
And how long did it take for the acupuncture to work?
It took a while. The first treatment, I did find some relief. I felt so relaxed, I didn't want to leave the room, but the lasting effect occurred over time.
What would be the 3 things you could tell our viewers that would help them in their relief of their suffering?
The first one is to identify, learn to manage, and where possible, eliminate your triggers. The second would be get an accurate diagnosis for your headaches. They can be caused by a number of other disorders besides migraine, and the treatment will vary. That said, use medications with discretion, as I've found out, and under the supervision of your physician. And don't add in herbs, supplements, and other therapies without consenting with your physician, because many of them can interact with the medications you're taking and can cause harmful side effects and actually worsen your condition. The third thing would be, if you haven't tried integrative therapies, give them a chance, because many of them help us relax, learn to balance our emotions, and can enhance the effect of our medications, decrease the amount of the medication we require. Many doctors of Western medicine are recommending them in their treatment plans for patients with migraine.
Sharron, thank you for being with us today.
You're welcome.